Karibuni sana, bienvenue to the Pathology Network podcast.
You have a guest coming into your house, then they start rearranging the furniture, taking the kitchen into the bathroom, taking the bathroom into somewhere else. I mean, just completely messing up your house. That's what the virus does. Completely changes the architecture of the cells in the cervix. And then now these changes, they become so bad that just things explode, then the cancer develops. For the men who get affected with HPV, they tend to suffer from infertility, because it causes reduction in the number of sperm and even abnormal sperm formation. We have 35-year-olds who are men and they are infertile.
So just to recap, HPV is a very common sexually transmitted infection. And the chances of a woman in her lifetime getting the infection, or even a man for that matter, are pretty high. And that majority of the people, about 95% of the people who get infected, will clear the infection. And then about 5% don't clear it. And when it persists, that's when it begins to cause problems. And not for this whole 5%, but a significant enough group that it could now begin to cause the changes in the cervix that now lead to cancer. Is that correct?
Absolutely.
Right.
And when you're taking those numbers, they might sound like very small.
Yeah, 5%.
5%, like what is it?
Sounds like 10 people.
Yeah, but when you think about it, in a country that has, let's work with Kenya, we have about 50 million people.
Right.
Half of that is women, so that's about 25 million. So if you're talking about 5% of 25 million, that's 1.25 million women dying from cervical cancer.
Right.
That's unacceptable.
Too much.
Exactly. We can't even have one woman dying from cervical cancer, something that's highly preventable, highly treatable. It's unacceptable.
Right.
And that's why even if in the mind, when you talk about the percentages, if they seem low, when you actually go to the ground, in Kenya we always say,
every to kwa ground is different.
Exactly. So when you look at the actual numbers, they're quite high.
It's a significant enough number that you would be doing a disservice to these 1.25 million women.
Yeah, think about all the orphans who come out of it.
Right.
All the socioeconomic areas that will have lost out because these are working women.
Right.
So it's not good for us as individuals. It's not good as Kenya as a country.
Right. So screening for almost the whole population. That's the target, that we want that all women eligible for screening go for screening to be able to capture that 1.25 million. Every eligible woman has to be screened.
Absolutely. And we are also answering the call by the WHO. I don't know if you've heard of the 90-70-90.
Right.
We want to see that at least 90% of girls aged between 9 and 15 have been vaccinated against HPV.
Gotcha.
70% of all women have been screened by a high-performance test against cervical cancer, and the high-performance test in this case is HPV DNA.
Right.
And 90% of women who have been found with a precancerous lesion or overt cancer have received cancer treatment.
Right. It's a big goal. But definitely achievable. We do have the tools at our disposal, right?
Absolutely.
We have the medical professionals, we have the tools. There's no reason that we can't achieve this and have a healthy population of women able to contribute their best.
Exactly. We have countries that have not recorded cases of cervical cancer in the last year.
Right.
Countries who have seen a decline in the number of cervical cancer cases, all because they screen and they vaccinate.
Right. And they treat. Right. That is, we have a big goal ahead of us, but I think we are up to the challenge.
Yes, we are.
So I'd like to talk about, we've educated, the women have gone for screening. What happens next? What comes next after screening?
Absolutely, that's a very good question, because some people think, oh my gosh, now I've achieved one of the 70% goals.
Right.
I've been screened. So what happens when you get that test? So when you have a negative HPV test, it's a good thing because it means that the chances of you developing any precancerous lesion in the cervix over the next 5 years is very minimal.
Right.
Because like I said, when you get HPV, it persists in your body for about 1 to 2 years. Then it starts causing the changes. And by the time the changes can be picked, it's about 2 to 5 years down the line.
Right.
And so For a woman, if they test negative, we can confidently tell them for the next 5 years, you don't need screening.
Right.
You can repeat the test in 5 years.
Gotcha.
But then for those who turn positive, they're the ones we have to make them understand that, number one, it does not mean that they have cancer or the precancerous changes.
Right.
It just means they have the virus.
Right.
They could be in the process of clearing, or it could be their body has not fought the infection well.
Yes.
And that is why for anyone who turns positive, we have to run diagnostic tests. And when we're talking about diagnostic tests, we have to look at the cervix. Now, we use a special, magnifying glass
Right.
called a colposcope, where it looks at the cervix under high magnification. And then we apply a dye. And the dye is nothing fancy. It's just the regular household vinegar.
Right.
The 3 to 5% vinegar that we
Yes.
use in our salads.
Right.
So we put in that dye, and it for any woman who has the changes because of the virus, the area that is affected will turn white. And that's when we'll know we need to take a biopsy,
Right.
test it, and we see the kind of changes that we have. And when it comes to the changes, there are again two main types. We have a low grade squamous intraepithelial lesion, what we'll in the pathology report you'll see LCIL. Then you have the high grade squamous intraepithelial lesion. Now, for a woman who has what we call LCIL, it means these are changes that the cervix produces while it's fighting the virus. It means that your body is doing its work. And for these women, we tell them, come back in 1 year, we repeat the HPV test, because we need to make sure that you've cleared the virus, and because if you've cleared the virus, those changes will not develop into cancerous changes, all right?
Sure.
And so, but we have to repeat the test within 1 year. And of course, if you're still positive, then we go back to looking through the magnifying lens, the colposcope, taking another biopsy. Now, for those who have a high-grade lesion, that means the body has fought and it has lost.
Right.
And so the virus has taken over and it's causing changes in the cervix. And these changes, they're pretty permanent. Imagine you have a guest coming into your house, and then day one, you live together well. Day two, you're living together well again. Then they start rearranging the furniture, taking the kitchen into the bathroom, taking the bathroom into somewhere else. I mean, just completely messing up your house. That's what the virus does. Completely changes the architecture of the cells in the cervix. And then now these changes, they become so bad that just things explode, then the cancer develops.
Right.
And so for these women, because we do not know how long they've had the virus, we do not know how long they've had the changes, they must receive treatment. And when it comes to treatment, unfortunately, there is no drug that we can give to swallow.
Right.
There is no pessaries, the one that for inserting
Yes.
into the vagina for treatment.
Yes.
No. The surgery is to actually remove the part that has the change.
Right.
And one thing about this, removal of the part, is we do something called LEAP. That's a big acronym for loop electrosurgical excision procedure, where we just use electricity through a very thin wire to cut off the part that is affected. Most of the time, it's imagine like you're cutting your nail.
Right.
So it's just like the tip of your nail that you're cutting. And that's what, so you still have your cervix. You're not removing the entire cervix.
Right.
That's a whole other procedure. But then for those women who maybe not have access to the LEAP, because it has to be done with a very well-trained person in a clinic or hospital that can be able to do the LEAP, because of course you're cutting part of someone, you have to make sure that you're doing it safely.
Right.
So for women who cannot access LEAP services or excisional services, then we have things like cryotherapy or thermocoagulation, which are available in a lot of the county hospitals in Kenya.
Right.
And there are nurses and clinical officers and even doctors who've been trained to do this, where they see the lesion, the area that has turned white, and they know which parameters to look at, the size of the lesion, where it has involved.
Right.
Is it a candidate for the particular treatment modality, be it cryotherapy or thermocoagulation? Both work on the same principle. You're applying either extreme heat or extreme cold to destroy those cells. And so for these women, it can be even a screen and treat kind of situation. You come today, you screen, you found 5 of the lesion, and the treatment is done all in one sitting, all in the same day.
Nice.
And now after that, the chances of a woman, of course, they'll keep on being followed up.
For sure.
Because we have remarkably reduced the chances of developing cervical cancer by over 95%. But again, because this woman has already had those changes, we still have to follow them up to make sure that even they don't develop other changes or develop cervical cancer.
Gotcha. So what you're saying is that once we do the screening, we can be able to now do further testing, further tests to look for the lesions if they're there. Because once you have the HPV DNA, all it says is that you have HPV infection. We don't know how far along it's been there. Are you in the process of fighting it, or is it in the process of making the changes that now lead to cancer? And once any of those changes are found, you can do a diagnostic test to determine what kind of change is there, if there is a change. And some changes are low grade, meaning that they have low chances of developing into cervical cancer. Just small change, and usually it means the body is fighting the infection. That's what you call LCIL. LCIL, yeah. Those are the low-grade changes. And then you can have more high-grade changes where the body is fought and maybe did not succeed in clearing the virus. So the changes have happened that are now higher risk for developing into cervical cancer. So then you can be able to then do some treatment modalities for that. You've mentioned the LEAP, which is a more specialized test. And then there are some other tests that are available, even in our county hospitals, most of them, where they can look at the cervix and treat all in the same visit, which is amazing, remarkable for anybody who's watching who has ever had any thoughts about how can I prevent cervical? I've heard it's a bad disease. It's, it affects many women in Kenya. How can I get help? This is a very good way to be able to see where along the pathway you can be able to get in and have treatment. Yeah, that's very good. Thank you for this. Would you like to add anything else?
Oh, absolutely. And two things, actually.
Right, go ahead.
One things.
Go ahead.
Yeah. One of the first things I want to say, I know there's some previous guidelines that said when you're doing HPV testing, also do it a pap smear.
Right.
One thing I need to mention, it has been shown, and even studies have proven that it is not cost effective and it's not even more efficacious to run 2 screening tests on a woman.
Right.
And especially right now in a country where we are struggling with a lot of issues with our economy, you do not need to put a woman through 2 screening tests, one being so markedly inferior to the other.
Right.
So it's recommended just do the 1 screening test, which is the high performance test, HPV, which the woman can collect the sample herself, or the physician can collect the sample depending on the preference of the woman.
Gotcha.
Preference of the woman or the preference of the doctor.
Right.
Yes. Now, the second thing I'd like to mention is, as much as we've mostly talked about screening, the primary prevention method for cervical cancer is vaccination.
Right.
So if for vaccination, we know that we have this virus, we have the HPV virus causing all these problems. But if you're able to vaccinate against the HPV itself, then the chances of us having women or young girls developing cervical cancer are minimal.
Right.
And the thing about the vaccine is this. Like any other vaccine, the polio vaccine, suddenly one out of my head, hepatitis, TB,
yes.
all those. We vaccinate before someone has been exposed.
Right.
Because think about it, these people who say, no, these young girls should not be vaccinated.
Right.
When you're giving your baby the oral polio vaccine, does the child have polio?
No.
When you're giving the BCG, does the kid have TB?
Tuberculosis?
Not
No.
at all.
Yes.
We are giving them to boost their immune system so that when they get exposed to the virus, then they can be able to fight the virus well, So that is why it's very important. We've said HPV is sexually transmitted.
Right.
Our goal is to make sure that those young girls and boys who are not yet sexually active, not yet exposed to the virus, we boost their immunity so that by the time they become sexually active, and they will be. We can be parents, we do not want to think about our children having sex, but they will be sexually active.
For sure.
But we need to have armed them sufficiently, boosted their immune system sufficiently so that when they do get the virus, when, not if, when they get the virus, they're able to fight it, eliminate it, and keep it from persisting, which then results in these cancers. And for, like I said, there's so many cancers from throat and nose, cervical, penile, anal, vaginal, vulval, and even the genital warts. All of this will be prevented. So please, let's vaccinate our young girls, our young boys, 9 to 15 years before they become sexually active. Yeah.
Can say to that camera right there.
Yes.
Call to action.
Yes, call to action. From the first thing you need to do, vaccinate our young boys and girls aged 9 to 15 before they become sexually active. And we screen any woman who has been sexually active for a minimum of 2 years. They need to start cervical cancer screening with a high performance test, which is the HPV test. Yes.
Right, thank you. I think we've had a lot of public discourse about vaccination since we had the pandemic and the COVID vaccine. And this one works a bit different than that one, where the COVID vaccine was to help the infection not be so severe. But the aim of the HPV vaccine is to actually prevent the virus from either persisting or actually even being there for too long a time, in that it's able to cause the changes and even make someone prone to spreading it. Because once you have it, you can very easily, we've seen it's a very social virus. It likes to go to places. So it's very easy to spread it. So yeah, I like that. And it makes a lot of sense. I think in the countries where they've been able to kind of dramatically reduce the incidence of cervical cancer, HPV vaccination has been very key in that. And targeting the right population, targeting people before they are exposed to the virus, meaning before they are sexually active. And yeah, like we've talked about, there's a whole regime of vaccines that little babies go through to prevent them from getting various infections. This is one of them that prevents a very common infection that has a little thing extra that it can actually cause cancer. So making cervical cancer one of the preventable cancers, which from a pathologist perspective, I can say not many of them are like that. Not many cancers are preventable. Yeah, that is excellent. I'm trying to think if there's anything more I'd like to talk about.
Maybe just one thing, especially when we talk about the vaccine, I know there's been safety issues.
Right.
And when you're looking at the vaccine, you want to know about what is inside that vaccine.
Right.
So some people will say, oh, it has virus.
Right.
It does not.
Right.
It has what we call viral-like particles. So they mimic how the HPV virus behaves, how it looks like, so that the immune system, the immune system deals with recognition. Right. It's a security guard. If I see someone with a face mask, that's the thing that thieves wear, not the regular face mask. Don't get me wrong. Yes. So if a security guard sees someone with like a sock over their head or something like that, they know that's a thief.
That's a thief.
So when you give the vaccine, now the immune system recognizes, oh yeah, this is a virus, and it now boosts itself. Then the other thing is that the vehicle that carries these viral-like particles, it's yeast. And yeast is, if I walk into any kitchen, I will be sure to find yeast.
Yes.
This hamira. Yes. We cook our mandazis, our mahamris, whatever. Yes. We bake with yeast.
Yes.
So even bread, it has yeast. So the only people who we say shouldn't get this vaccine if they have an allergy to yeast, which is such a low number. I don't think I've ever seen anyone who's allergic to yeast.
Same here. Yes.
So it is very safe. It does not contain the virus. It has no hormones. It can't make someone infertile, and it cannot make someone. It's not a form of contraception.
Yeah.
It has none of those capabilities, and so it should not be taken as such.
Right.
And it's perfectly safe. The main side effect that we have is pain at the incision site. Right. But you tell me, which injection have you ever gotten that you didn't feel pain?
Painless, none.
There's none, So, and you see, with the HPV, and I think maybe I did not mention this, the virus itself, when you're talking about men, when it's for the men who get affected with HPV, they tend to suffer from infertility, because it causes reduction in the number of sperm and even abnormal sperm formation. And that's why it's also important to vaccinate boys against this, because we have 35-year-olds who are men and they are infertile. These are very young ages. Studies have shown that it can be traced back to HPV infection.
Right.
And so tying it up with the HPV vaccine, it's very important to vaccinate both boys and girls to prevent all these problems.
Right. So the vaccine is not just for girls; it's for boys and girls.
Boys and girls.
That is what is going to make the changes we need to see in our cervical cancer numbers down the road.
Yeah,
makes a lot of sense. And coming from a pathologist who's been practicing in this current landscape where cervical cancer is an all too common diagnosis, we can make it, multiple times in 1 week. So it's a common thing to be able to have that changing into where we barely ever diagnose cervical cancer would be amazing. It would be an amazing step towards having a very healthy population of both men and women. That's been a good conversation. Thank you so much for being with us. We have had with us today Dr. Anisa Mburu, a gynecologic oncologist, and we've been discussing HPV DNA testing, and cervical cancer, and how we can be able to work together to eradicate cervical cancer from our population. My name is Dr. Mburu. Thank you for joining us.
And thank you for having me.